This is not endorsement, it's harm reduction. If someone chooses to use, this is what the research actually emphasizes monitoring. The safest option is obviously not using anabolic steroids, but harm reduction matters because people are going to make their own decisions. The research emphasizes involving a qualified healthcare provider and being honest about use, not just pulling labs in isolation, but having medical oversight that can interpret trends over time. When abnormalities are found, appropriate medical management should be guided by a qualified healthcare professional who's aware of someone's steroid use. From a blood work standpoint, this means comprehensive monitoring 2 to 4 times per year, including standard lipid panels, a complete blood count to track hematocrit and hemoglobin, and metabolic panels. Plus higher risk markers like HbA1c to track insulin sensitivity over time, apolipoprotein B, oxidized LDL, lipoprotein A, homocysteine, and inflammatory markers such as high sensitivity C-reactive protein. Additionally, more frequent glucose monitoring, whether through fasting blood sugar checks or continuous glucose monitoring, may be reasonable for some individuals. There are established medical thresholds clinicians use in TRT settings to manage potential side effects such as elevated hematocrit, and similar monitoring frameworks are what harm reduction models point to for people using higher dose androgens. Blood pressure should also be monitored regularly. Weekly is the bare minimum because hypertension is a common side effect of anabolic steroid use. Beyond blood work, structural and functional cardiac monitoring is emphasized. So periodic ECGs, echocardiograms, and in some cases coronary calcium scans to detect plaque and cardiac remodeling early. From a use pattern standpoint, cardiovascular risk increases with higher weekly doses and longer lifetime exposure. Minimizing dose, avoiding prolonged uninterrupted cycles, and not stacking unnecessary compounds or other illicit drugs reduces risk. It does not eliminate it, but it shifts the risk curve. Lifestyle really matters too. So good sleep hygiene, cardiovascular training, avoiding stimulant stacking, minimizing alcohol intake, and maintaining reasonable body fat levels all influence cardiovascular strain. It's also worth noting that risk is not uniform. Underground market sourcing introduces unknown purity and dosing. And individual genetic susceptibility means 2 people can have very different cardiovascular responses to the same exposure. Harm reduction doesn't make something safe. It just acknowledges that risk exists on a spectrum and that earlier detection changes outcomes.